Welcome to another video from Urology Nevada. My name is Ross Anderson, and today we're going to discuss urethral strictures. Specifically, what is it? Who gets strictures? What are the common causes of urethral strictures? And what are the symptoms? This video is intended to provide information to patients about urethral strictures, and it does not replace sound medical advice from a physician or other provider. First, we want to define urethral strictures, and it is an abnormal narrowing or scar tissue of the urethra. To help understand how an abnormal narrowing of the urethra can affect patients, let's take a look at basic cartoon anatomy and drawing of the male urinary system. The kidneys filter blood, which makes urine, and then it is transported by the ureters down to the bladder, where urine is stored until a person decides it's time to empty their bladder. Taking a closer look, when the bladder fills and men start to empty their bladder, the urine passes through the prostate and then out of the urethra and then to the outside world. Now this is a cartoon of what a stricture could look like, seen as the narrowed two triangles here within the urethra. When men try to pee, it becomes blocked by this narrowing, and the stream can become slow, and also the stream can deviate, making it hard to pee in the toilet. Other symptoms that men usually present to the doctor with are feelings of burning or pain with urination, slow stream, inability to empty their bladder, or they've started to get urinary tract infections. Rarely, it can lead to the inability to urinate or urinary retention. You are not alone if you are a man with urethral strictures. About 0.6% of the US population has urethral strictures. This can also occur in females, but it is far less common. An easier way to look at this number is that 1 in 200 men in their lifetime will have urethral strictures. Strictures can happen to boys or men of any age, race, or ethnic background. The average age is about 55 years old. Most men don't know why or how they got urethral strictures. This is what we call idiopathic or unknown cause. It is the most common cause or reason that men have urethral strictures. Other causes include straddle injuries or pelvic fractures. Urologic procedures, or rarely urethral Foley catheterization, can also lead to urethral strictures. Sexually transmitted infections also rarely cause stricture. A condition called hypospadias, where an abnormal location of the urethral opening that boys are born with, can also be associated with urethral strictures. So in summary, we defined urethral strictures as an abnormal narrowing or scar tissue within the urethra. We looked at the anatomy of the urinary tract. We discussed the symptoms of strictures, specifically what men feel, how common strictures are in the population, and what causes strictures. For more information, see our next video in this series on our YouTube channel, Urology Nevada. And our next video is titled Urethral Strictures, Diagnosis and Treatment, or come see one of the urology providers at Urology Nevada. Here is our contact information. Thank you for your attention.